So I did want to go through the final review of the results of the frequency analysis, keeping in mind that these will be the elements that will be on the survey, but you guys will have the opportunity to recommend other elements as well. So by all means, this isn't a comprehensive list. This is kind of a starting point. And then, of course, if you have other things that we think should be added to the survey, those can get added into subsequent rounds. So I will jump into the Delphi survey process a bit today. We're still working on a little bit of coding, and I did want to get a little bit of feedback from you guys before we officially launch. So we'll go through that and then just briefly go over kind of what we're thinking for the timeline of getting through these rounds. So here is the kind of final results that we have here for the frequency analysis. Um, just one thing in addition to just the frequencies of how often these elements showed up in the different data sources, we also have what other specific data elements that were recommended for review by this group, by the CDE steering committee. So I've marked those here just with an asterisk. So the frequencies you notice might be a little bit low for a couple of elements. Those elements were specifically recommended for review by this group. We have approximately 50 elements here that we believe apply or could be applied to the specific work group. I have them bucketed here into these different kind of categories just so that when you guys are taking the survey, similar elements are kind of be grouped together and you're not jumping all around to different types of elements. So this information, patient injury, and facility isn't going to be on the survey anywhere. This was just a way to kind of bucket them for ease of reviewing. So we're looking at similar elements at the same time. So I will send this list out after this meeting. And then in a second here, when I jump into the survey, eventually when you guys look at the survey, this list will also be provided to you. So if you're interested in just what are all the elements that are going to be in the survey that you're about to start, you can have that available to you.
Nick, are there going to be any definitions with some of these? For example, education participation, what that means, or
Yes. So in a second here, I'm going to jump into the survey. Every single data element will have at least one definition assigned or connected to it for you for your review, and it will be up to this work group to determine if there's multiple definitions provided, which definition you think kind of matches the best. So absolutely, there will be definitions provided for every single data element.
Hey,
okay,
Nick,
great.
on facility, you have drugs. How does the drug screen indicator on facility? I'm not sure what that means. And then drug screen results. Wouldn't that
So
be patient level thing as opposed to facility?
it could absolutely. I bucketed patient as more demographic type of information, whereas the facility information would be, okay, this patient has already reached the facility and now we're conducting some type of care or doing some type of test. But absolutely, it's still related, of course, to the patient. And whenever the term indicator is used, that would be an example of a data element where it would be a yes, no. We did this or we did not do this. And then the results would be a separate element of what came out of that, in this case, alcohol screen or drug screen.
Can you just teach me for a minute? How does a facility doing an alcohol screen, what does that mean? How does that relate to our question?
So this is a particular data element that happened to show up quite frequently in the sources that you all recommended. So alcohol screen would be something that it's just a data element where there was something on the form that said, did you perform an alcohol screen test or a test of blood alcohol content? Yes or no, and that's a question in itself. Did you do that? And then another common element that came up was, okay, what were the results of that test? So once again, we didn't filter out elements, even if you don't think that necessarily applies to this work group, that's what this survey is going to kind of be for. If you think that this is something that's applicable, we can include it and create that data element within the system. If you think that that potential data element belongs to a different work group, and a different work group should be looking at that element, then they can be the ones that add it to kind of their group of elements. Any other questions about what we have here? Great. So these are all the elements that are going to be imported into the survey. This survey, we plan to be launching, I think, as of a week from today, would be the kind of get everything started and sending out these emails to you all to get started on these surveys. So today we'll be kind of going through what they look like. You will be receiving an email when we launch this survey. I'll jump right into my email here in a second and show you exactly what it's going to look like. It is going to be coming from this company that we're using to build this survey called Calibrum. The way that it's currently displaying, it will still be from Pam, but the email address itself will be info@Calibrum, and then that's how you'll get into the survey. So for every round we'll be sending these out, you guys aren't going to need to navigate anywhere. We'll just be sending you a link to the survey for that specific round. So this is kind of what it looks like when I got, so it just is from Pam Bigsby, right? And then here on the right-hand side is just what it's going to look like. You know, you've been invited to participate in this work group survey, this Delphi survey. I know there are some of you that are on more than one work group, so we are including that verbiage here in the email.
Like a phishing email. Next.
Yeah, yeah, and it could potentially go into your spam as well. So that's something to keep in mind. I will be sending out an email letting everyone know, hey, everybody, we're about to send out the survey link to you. Keep an eye out for it. So that way you're aware that it's coming in. And then also if it happens to go to your spam or something, then that's clear. Can everybody see my screen or did I switch out?
You got it.
You're good? Okay.
Nick, I may be the oldest guy on here, I don't know, but can you remind me of our question? What question are we trying to answer?
So we are determining, and that's a great question. We have all of that text available on the very first page of the survey to remind everyone why we're here. And that's to determine which of these data elements do we want to get created for existing within the NTRR. So that way we can create this common data element standard. So that way as other studies are completed, we can ensure that these studies are sticking to a very particular standard in which they are collecting these elements to allow for better meta-analyses on the back end. If we are all collecting data in the same way, then that's going to make for future analysis a lot more accessible and a lot easier. Smitty, I assume there will also be an email from Center letting us know. Exactly, yes. So great question. Yes, we'll be linking those up perfectly. An email from me and then a subsequent email from Calibum/Pam, so you guys are aware. So I'm just going to click on take the survey and jump into this with you guys. Dr. Holcomb, this right here, we try to, as best as we could, share these instructions with you all for what this is going to look like. And what your kind of purpose of reviewing in this survey is. So the purpose of this Delphi survey is to determine which data elements will be included in the NTRR as basic common data elements. A basic common data element collects essential information applicable to a specific therapeutic area. We do have a list here of those therapeutic areas. Those are all the different work groups that are currently completing this process. So they've all done their own frequency analysis to look at their specific data elements for their areas, and are all going through the same exact process of determining what elements do we need to create and import into this NTRR so we can standardize how this data is collected and reported. For each one of these pages, as you work through this survey, you will be asked to consider the data element in the survey in the context of your work group. and rate it on a scale of 1 to 5, your level of agreement for its inclusion in the NTRR. This 1 through 5 is something that we're still currently working on. It may not necessarily be a scale 1 through 5, but it's going to be a, do you agree with putting this element in, or do you disagree with putting this element in, essentially Likert scale. You will be able to provide your rationale for your rating to share your thoughts, and then those comments will be anonymous, and you'll be able
Nick,
to view them.
I'm still seeing the intro screen. Are you just reading it off, or?
Oh, I'm sorry. I had asked earlier if y'all could see it, and I thought you guys could.
Well, up until
Screen
that point, it
2.
looked like, yeah, it looked like we were on the same screen you were talking about. But if you're going through the survey, I'm not seeing the survey.
Okay.
Now we're seeing your email.
Email? Okay. I'm sorry about that. Thank you for letting me know.
You guys thinking about doing a 3-point Likert scale? Yes, no, I don't know. To get separation.
That's in the discussion, and that's part of our call today. Can you see the screen now?
Yeah. You see
Should
in the
have
intro,
it should have the NTRR logo at the top.
yeah.
Okay.
Yeah.
Sorry
Yeah,
about
we
that.
can see.
Yeah, I was reading through this. This is where when you do navigate to the survey, this is what you will see. So it's the very first kind of landing page, and I've just been reading through this. We have been considering changing the Likert scale. We are interested in getting your feedback before we launch. We have been
3-point.
meeting with the executive committee as well as CDE steering committee to get input. Would you have a point, Dr. Holcomb, that you'd like to make?
I would vote for, I don't have a vote, but I would vote for a 3-point for this
Okay.
group. It's yes,
Just
no, I don't care. All right, 3 points.
okay. And then I will be able to share what that looks like in a second. So if anyone else has any feedback for what they think they would prefer, we can take a look at that. And we, of course, would like to hear your feedback on how you'd like it designed.
Hey, John, why are you suggesting a 3-point? I don't disagree. I'm just kind of, because you think it'll make people more definitive, just to have to
Yeah.
decide on which data elements. Like, what are your thoughts on that?
Yeah, I think you'll get better separation, which is what you want.
Yeah, yeah, I agree. I actually, I really agree. I think, Nick and Pam, I think we should maybe consider that for the other Delphis as well, because what we don't want a bunch of things aggregating towards the mean, like 3.5 for everything, which is when people get lazy on these surveys, that's what you end up doing. And so I think this will really make people think about, yeah, this should be a data element or it shouldn't. So I think that Dr. Holcomb's suggestion is something that maybe should be considered for, all the surveys.
Absolutely.
Kind of like pulses, they're either there or they're not.
Right. Right.
So you will be able to provide your rationale. So if you say, hey, I think this should belong, you'll be able to add a comment. I'll jump into showing you guys an example of that in a second. Whenever a given element does reach consensus, so 80% agreement on inclusion, at that point it will be kind of sent, eventually it will be sent to the CDE steering committee for review, and those elements that reach consensus will be removed from subsequent rounds. So the idea of this survey is that there will be 3 rounds. So if it reaches consensus and we all think it should belong, then in the next round, you're not going to see it. We do have an order of precedence that we've shared. I'll click on that in a second regarding the definitions that are provided to you. So the CDE steering committee as well as exec have looked at what are all the different existing sources of definitions and how do we want to look at those and in what order for providing them to you. So FITBR and NTDS definitions are provided. A reminder that because this system is going to be very closely integrated with the FITBR system, that is going to be kind of our #1 source. If a FITBR definition exists, that definition will be provided to you first. Of course, NTDS is how you all are used to kind of collecting data, TQIP data, so that will be provided as well when that data element exists. When neither of those exist, then we get down into some other sources, NINS, NIH, and others. At the end of round one, you guys will have the opportunity to suggest additional data elements. So as I said, I've provided that list of what happens to have shown up frequently, but of course there may be things that we are missing. So at the end of round one, you will have the opportunity to provide other data elements that we can potentially or subsequently add to the other rounds that we can then get reviewed. And then, as I said, this will be 3 rounds. If after 3 rounds an element has not reached consensus, then it will not be adopted. We, at the end of those 3 rounds, will be reviewing what has reached consensus and what hasn't. The idea being we'll kind of come back together, look at what we've determined, and then if there wants to be a discussion, if someone feels very strongly that maybe something was excluded that shouldn't be, then that will take place kind of at the end of the survey.
Hey, Nick, I'm sorry I have so many questions here, but so we're supposed to get common data elements for any trauma study ever done. Is that right?
Not necessarily. So we're focusing specifically on epidemiology in this work group. So if you feel like it's related or could be potentially collected and used in any type of analyses in that way, then we would like to include it. Still, of course, relating to trauma, but not necessarily something that would be required to be collected in any trauma study.
Yeah,
This
but
is
but I think that all of the different, there's a pre-hospital work group, there's there's a bunch of other work groups. So overall, comprehensively, we're looking at, like, each work group is looking at a section, but to Dr. Holcomb's question, like, big picture, that's where we're going, right? To get the common data elements for, I mean, any trauma study ever done. That's the way you ask it, Dr. Holcomb?
Yeah.
So the depth that we're getting to for the first creation of these common data elements, I wouldn't say gets that deep, Dr. Holcomb. As this system will continue to grow over time. And eventually what will happen is if you have a very specific study that the common data elements haven't been created for that, you will be using the common data elements as kind of the backbone. And then if there are other things that your study collects, you'll have the ability to create what are called unique data elements. And what we'll see is that if there are unique data elements that are commonly occurring, those unique data elements can eventually be converted into common data elements. But the initial setup of this project is to kind of focus on a bigger picture than necessarily every single element.
Yeah.
Also, just to interject, we also the CDE steering committee has selected a group of core elements that, yes, Dr. Holcomb, would be recommended to be collected for all trauma studies, and that's a very small set. And nothing, I think there's 2 that are actually required, but the rest are just strongly recommended. So
Yeah.
there will be that core. And that's called the core. And what we're looking at now are kind of the basics that will be recommended for these separate areas.
Yeah. And how did Fitber and NTB go through this fairly regimented process to develop their data elements?
Bitbird did. I'm not as familiar with NTDS's process for how they determined what elements were created, but we're following a pretty similar process for what Fitbird did, and they've done this kind of a couple times at this point because it's been around so long. This is a very similar process of breaking up into work groups and analyzing, getting subject matter experts for these specific areas, and the subject matter experts reviewing data elements and coming to some type of determination on what are we going to at least start with, and then the program can.
You might just ask Avery Nathans how they did NTB at the beginning. I don't know the answer to that. I think it's kind of interesting. And certainly in your methods paper, if you can say we did the same process at those 2 databases, if you will, that are so commonly used that as you said, are being used as a basis for where we start would be important.
Sure.
My guess is they didn't. It's been around for so long. I bet they just dreamed them up.
If I could add to that, hi, everybody, this is Michelle Price. So NTDS, of course, is drawing from the trauma registry. So those were elements that were in the electronic health record, or, previous to that, before it was electronic. Those are actually collected for the medical record.
Well, but Michelle, yeah, age, right? That's certainly in the medical record, but the definition of surgical site infection or massive transfusion, or those definitions are in the National Trauma Database and are not in the EHR, right? But that's where those come from.
Yes, sir. You're correct. Yes.
Yeah, I just, we're going through a very regimented process here to determine common data elements. And FITBR did that. I don't know if NTB did at the beginning. It's kind of interesting.
And just for covering down on their processes, Avery Nathans is a member of the CDE steering committee.
Sure, of course
He's
he is.
providing input. Yeah.
At the very bottom here, we do have some supporting documents. So the list of elements that I shared there with the frequency tables at the beginning, that is here available for you. Also, be kind of sending that out after today's meeting. The list of the core common data elements, so those that will be recommended for collected for all trauma studies, is listed here. So I do have that. We've reviewed these in the past. This was determined during a full 2-day in-person meeting. So here are those core that will be recommended for inclusion of all trauma studies. And then the order of precedence chart, this is how we've collected the different definitions and the order in which they've been provided to you. So when you do have definitions that we're looking at, actually, so we have FITBR first, and then NTDB, and then NINS, NIH, and then one more final repository as well. So these definitions will be provided to you in this ordering. And then it's not a comprehensive. If we have a FITBR and an NTDS definition available for both, then we kind of stopped at that point. So just a comment from Smitty, process is also representative of a current Delphi methodology that you all have been using, if I'm correct. Awesome. So when you do start the survey, you'll just click down here at the bottom. This is still in somewhat of a staging site, so I'm going to go to a page that's nice and clean for you. And this is what it will look like. At the top, it's going to repeat these instructions. Listed below are commonly reported data elements and definitions identified through that frequency analysis for your work group. For each data element, please indicate how strongly you agree or disagree with its inclusion. As a basic CDE for this therapeutic area, definitions are presented in their order of precedence. Please indicate your recommendation for their adoption. So the first data element on this particular page is the patient's home city. Here in the notes, it's just how frequently that particular element showed up in our frequency analysis. And then on the right-hand side is that Likert scale I was talking about. So as you all recommended, a 3-point versus a 5-point, this is where we would make that change to a, disagree, neutral, agree. Once again, the question is, how strongly do you agree or disagree with this element as be included as a basic element for epidemiology? You also have the option to click not my expertise if you feel like this isn't something that you want to particularly weigh in on. And then below that, we're going to have definitions from the different data sources that I've mentioned. So sometimes these data sources will be, kind of an exact definition that's very, very specific. And other times the definition that's provided in this particular system is kind of a little bit more broad. So that's why we'll be looking at which one of these definitions you all would prefer. Now, I do want to mention that I would like to get some feedback from you all on these definitions, and that is currently we have a rating scale of do you recommend this definition, do not recommend, highly recommend, and you would do that for each definition. But the idea of switching to ranked has been proposed. And I would be interested to hear your thoughts of just here's the 2 definitions, rank them 1 and 2 for which one you think should be used.
So Nick, in there, why not zip code instead? So like Houston.
We have Dr. Holcomb, that's a different data element. So we do have zip
But it's
code
that, yeah,
available as well. So
but
this is
shouldn't
just
it
an
be right
example of
there as
one.
well? So you can pick it? Where is the zip code?
The zip code is a different data element. So this specific data element is, do you all want to collect patient home city?
No.
Yes or no?
No, but if you have zip code, the answer is no. If you don't have zip code, the answer is yes.
Okay, so we could potentially have both. And that would
No,
be
but you want
that
to decrease the number of common data elements, right? And that's the goal.
I'm sorry, say that again.
Don't you want to decrease the number of data elements that are considered common?
I wouldn't say necessarily that we need to decrease them. There is literature on there being potentially too many common data elements, but we're talking about systems that have thousands and thousands of data elements. Our group's only reviewing 50. Each work group is reviewing about 50. So this entire process, we're talking about, maybe a couple hundred common data elements. Now, that being said, if you feel like we should be collecting one or the other, then at that point, I would love for you to leave a comment, at which point we can have a discussion about whether others think that we should decide on one or the other, or whether it's valuable to have both.
Nick, I think zip code is one of, isn't
It
that one?
is.
Yeah, there
It's
is
two more
Dr.
data elements down. So this is why we've kind of grouped them for similar elements. So that way, or even before you jump in, if you have other thoughts about potentially collecting one or the other, then you can make sure that you can leave a comment and we can then have that discussion. So you can see here we have patient home city, definitions, patient's home state, definitions, patient's home zip code, definitions. And now those have been grouped together all on one page for you. If you think that, potentially they should all be collected, or we should be focusing on collecting one versus the other. So any thoughts behind changing how we will determine which definition to pick?
Hey,
Which
Nick.
definition will be selected? Yes,
Yeah,
sir.
yeah. So I guess my thoughts have to do with how is this registry going to be populated? So it's going to be a warehouse for data, but how are the data going to enter this registry? And so if the intent is to, passively populate it with existing registry data, that are in, potentially FitPer, NTDB, then it becomes very, very important, to try to increase, the correlation between this registry and other existing registries. And it goes to your question about order ranking, the existing registries with regard to what would be the data element we're going to most recommend to be included in NTRR, because if this is going to be something different, where it's going to be populated de novo based on some new element of record review, et cetera, and then and then data inclusion, that's different. If it's just sort of a freestanding, it sits by itself. But if the idea is that we want to populate it based on existing registry data, then I think it really is important that there's some correlation. I don't know what others in the group think, but just in terms of being able to actualize it, I mean, I think that's an important consideration.
I think this is really designed for the future. So as you design future trauma studies that will be funded by the DoD and others, you would include these data elements in terms of going back and putting in studies that may have been collected from registries or whatever. A select number of those may be, but I really think this whole project is designed for future studies that are going to be, let's not use the word required, but highly, well, in some cases they'll be required to enter their data into the NTRR. And so this gives them a way to plan their data collection for that study.
That's correct, Dr. Schulman. So we will be looking at legacy data and importing data from studies that have already been completed, but the idea is more kind of forward into looking towards the future. And as you said, particular studies that will be required to, any DoD funded study is going to be required to submit their data to the NTRR. So they're going to have some type of standard that they can follow for how they're going to be collecting their data.
Hmm.
Any other thoughts as to how this is structured, or any other input or changes that you all, think could potentially make this smoother or more efficient or get better results?
Just to the question of, I think in terms of selecting definitions, it makes more sense to rank them, because I can see where across in this group and other working groups, people will highly recommend every definition, and then you have no discrimination between which is the best one, versus forcing us to rank them. Then hopefully one of them will rise to the top.
Thank you, Dr. Jarman.
Nick, I'm focusing on the zip code and home city as an example here, but can I go back and forth? Like if I say home city is important, right? And then I get farther down the thing in zip codes. Zip code is better than the city because of the economics and deserts and blood deserts, etc., that happen throughout the city of Houston, for example, or San Antonio, wherever you are. Can I go back and change my answer once I set?
Yep.
Okay.
Yeah. Eventually, when you get to the very end, the last page before you submit here will be are there any additional elements you think should be considered? So if by all means, if you answer one question and then you see something else and you want to go back and change your answer, you can absolutely do that. And then this will be kind of the ending page where you could potentially add more elements. And then from there, it's hey, here's kind of what's going to happen next in the process. Thank you for finishing this, this particular round.
Dr. Holcomb, see at the bottom, there's a back arrow and a forward arrow. Those appear on every page.
Okay.
So you can go back and change your mind at any time and just go back.
Yeah, it's good. Thanks. It's just,
Also,
the groupings may make sense to you guys, and I'm sure they do, but it'd be nice to be able to go back and forth a little bit. Thanks.
Also, Nick, won't you be sending a PDF in advance to everyone via email? So if you wanted to have an overview, on a side screen, you'll have that as well. That'll show you everything that you'll be looking at.
Yeah, this Excel here on the very first page will have a list of every single element, and as well as the definitions that are imported into the survey. All right. Last thing is kind of a rough kind of timeline of what we're thinking of how these Delphis can flow. And that being kind of launching this time next week, making these final kind of coding changes regarding the Likert scales and whether we're going to switch to ranked. But overall, the general format of the way that these surveys are going to be set up will be the same. It may just look slightly different when it comes to how many options you have on these Likerts. The idea is that I will be communicating with the entire group when we'll be sending out round one, and then Pam will be sending out the actual survey to you. We will give you 3 weeks to kind of complete that survey. So we believe that's sufficient time. I don't think it should take you that long to get through about 50 or so elements, but we understand you all are very busy. And then after those 3 weeks, we'll have a week for our coding side to determine what's reached consensus, remove those from the survey, also look at other elements you all have recommended and get those added in. And then we'll move on to round 2. And then kind of repeat that process. And then any common data elements that haven't reached consensus, we'll move on to round 3. The idea being that we're going to try and finish before July, and you guys get all your new residents coming in. We can kind of get all of these surveys knocked out. And then eventually plan a meeting for sometime in either late in July, early August okay, we have all the data. Let's circle back, set up a call, go through all these elements. This was determined. Look at the analysis for what elements have been recommended, and kind of see if there's any other discussions on elements that maybe were close to consensus, things like that. And then from there, we will be writing up a white paper of our recommendations and providing that to the CDE steering committee. The idea being finishing that at kind of the end of the summer, beginning of the fall.
You know, I think as a guiding principle, and you guys will have a steering committee meeting, you probably had many. We would want to have the fewest possible common data elements, I would think. You know, I haven't created many case report forms for studies. You always end up with too many, always. And it's difficult to collect those data.
Yeah, but on that same note, then you go and do the analysis and you're like, why didn't we collect this? So I mean, I think
comment. You can always add for specific studies, but
right.
fewer common data elements across all studies. Right? I mean, so you can collect 900 data elements on each patient, and your paper only presents, you know, a very small percentage of them. It's an interesting phenomenon.
So John, just also keep in mind, these are all only recommended. There's only going to be 2 required core data elements. The rest will be strongly recommended, and these common data elements, these basics, are going to be recommended. So I think the idea is, if you're going to collect these variables, do it in this format, not necessarily that every study is going to collect every single one of these common data elements. So,
Well, then they're not common, right?
well, they're common, they're just not required. They're all collected the same way. I mean, I think the language that's going to go into this is going to be either recommended or strongly recommended. But I don't, there's only, because of discussions that were had at the steering committee, we realized that requiring things just means, you know, certain studies done certain ways could be excluded. So we've shied away from that.
Well, then there's only 2 common data elements. Everything else is recommended.
The word,
So
no, so the semantics of the word is, they're all core data elements. There's some basic core data elements, and there's going to be only a very few, like I think was mentioned before, just 2 that are truly required.
Smitty, you had your hand raised?
I was going to say something very similar to what Carl just said. So common data element doesn't mean that it's commonly present in all studies. It's a informatics term, data science term, meaning that there's a standard definition across a field. So like I think it's Carl did a great job clarifying the language. Just to add that it's a common data element is a specific technical term from data science and informatics, meaning there is a definition that exists, it's accepted by the scientific community that whose field it applies to. So saying that we have a common data element around race is to say that we have an agreed upon definition about how we want to capture this information, not to say that this is the only way it could ever be captured. You know, there could be a justifiable reason to capture it differently, or just a reason to exclude a common data from a specific study. But if it's going to be included, it should use this definition.
Yeah, that's very helpful, actually. Maybe we should put the definitions of these data elements at the beginning, right? There's required and there's common. I think many of us non-epidemiological trauma surgeons would think common means required across all studies. That's certainly what I thought.
Sure.
And that would change the way you answer the questions, I think.
Any other comments? I know we ran a little bit over and I want to be respectful of everybody's time. All right. You guys will hear from me. I'll be sending out all the kind of content that I shared with you today. So if you do care to review it or do have any further questions, please don't hesitate to reach out. And then we're looking at next week being the launch date. So you will hear from me letting you know that we're launching, and then you'll receive that email from Pam and Calibrum. So please just feel free to reach out if you have any questions or have any issues about getting started with the Delphis.
Thanks, Nick. Molly, get outside so you can see the people.
Thanks. I should be there just in time for the first wheelchair racer.
Perfect. Thank y'all so much.
Bye.
Have a great time.
Thank you all.